What is the life-threatening side effect of clozapine? So clozapine is used in schizophrenia. Clozapine is a second-generation antipsychotic, and it's typically reserved for treatment-resistant schizophrenia and patients with a higher risk factor for suicidality. It causes the life-threatening side effects of agranulocytosis. So what exactly is agranulocytosis? You know, when you have neutropenia, which means low neutrophil count, you, as a patient, they're more predisposed to recurrent infections and a weaker immune system. Having agranulocytosis, which is a more severe progression of neutropenia to the point where the patient is in a life-threatening state, they're extremely vulnerable and they're extremely prone to infection. That is not good at all. So in those situations, in agranulocytosis with seriously low neutrophil count, less than 0.5 times 10 to the 9, the patient will present with tiredness, fever, shortness of breath, and infective symptoms. So in what situation will you give a patient clozapine if it's got such dangerous side effects? In a schizophrenic patient who has tried haloperidol, quetiapine, risperidone, what's common among those three? They are all typical antipsychotics or first-gen antipsychotics, and they've had minimal improvement. We might give clozapine, and if the patient was suicidal, that is another indication. Okay, and clozapine zaps the neutrophils. That's the mnemonic I've come up with. Clozapine zaps the neutrophils, and the other three drugs, the three C's of medicine, carbamazepine, carbimazole, and clozapine, all three of these can cause agranulocytosis. Treatment of a patient who's entered agranulocytosis, you start off with IV antibiotics like piperacillin, tazobactam, and then you can give granulocyte colony stimulating factor.